Good afternoon. My name is DARYAU, a QT Exercise and Movement Science student. Today I'll be undertaking an initial consultation for my client for her improved fitness and health-related goals. Pre-exercise screening is an important tool to identify whether or not it is safe for individuals to perform certain types of physical activity. Norton and Norton describe pre-exercise screening as identifying people who may have medical conditions which put them at a higher risk of adverse events during physical activity and/or exercise, thus being a filter or safety net to help determine if the potential benefits of exercise outweigh the risks for an individual. The topics that will be put forth in this presentation will include the DARYAU questionnaire, a medical health and health history, signs and symptoms of injuries that prevent exercise, as well as a coronary risk factor analysis, lifestyle evaluation, and disease risk classification. From the initial conversation and examination with the client, the following information is presented. The client is a 22-year-old female with a height of 174 centimeters, weighing 70 kilos, which a BMI was calculated to be 23.12. The client is a non-smoker, is active for more than 150 minutes per week, has a normal blood pressure, normal cholesterol, normal blood sugar level, has had no previous hospital visits, is on no regular medication from the oral contraceptive pill and PRN anti-inflammatories for a bulging L4 to L5 disc. The client exhibits slight joint pain, however has previous back injury that is being properly rehabilitated. The client put forth that she exercises with a moderate intensity with a heart rate of 55 to 70. The client initially underwent the ESSA pre-exercise screening tool, which yielded positive results, in turn stating it was safe for her to undertake physical activity. The DARYAU and U questionnaire, which determined the readiness to perform physical activity, the coronary risk factor analysis system, which established the number of coronary heart disease risk stratifications, the lifestyle evaluation, which provided an insight into her living habits. The client answered no to 6 out of the 7 questions relating to the presence of any cardiovascular or metabolic risk factors, however answered yes to having a bone or joint problem. The client's current activities include touch training 2 times a week of 80 minutes each, resistance training of 1 session per week lasting 60 minutes, netball coaching of 2 sessions a week lasting 60 minutes, running based on her current feeling of 1 to 3 sessions per week lasting 30 minutes. The client's ADLs include university 4 times a week as well as working 3 times a week. The reason for the client's appointment is that the client is experiencing difficulty getting back on track with a touch football season fast approaching. This consultation will envelop the goals of health, behavior, and exercise performance. The client's main goals are to improve her muscular fitness, strength, and endurance of her upper and lower body to improve her sporting performance. This includes developing a nutrition and resistance training program that will ensure that the client's goals are met. In a study conducted by Gabbett 2007, it was found that elite sportswomen have slower speed and agility, a lower muscular power as well as glycolytic capacity, but showing a greater body mass and skin fold thickness, which proved that they were more prone to injury and fatigue-related errors in skill execution. Majuka et al. 2009 studied the fitness determinants of success in women's football and found that fatigue can be reduced by resistance and weight training, as well as cardiovascular and endurance training. Seffen et al. 2008 found that preventing injuries in female touch football, especially for females who had previous injuries, found that core stability, balance, plyometrics, as well as strength exercises reduced the number of injuries in the population that adhered to the exercise program. Proper rehabilitation coupled with resistance training and endurance training reduced the reoccurrence of back injury and lumbar disc prolapse, as well as proper education and pain management. Kibler et al. 2006 and Burton et al. 2006. From the literature reviewed previously and the aims and objectives of the client and practitioner, it is evident that the following goals need to be met in order for the client to be able to safely participate in the upcoming touch football season and as well as for her general health and well-being. These include developing an exercise program, proper rehabilitation, flexibility, plyometrics and core stability training, muscular strength training, explosive power and coordination training, as well as keeping a food and exercise diary to monitor. Thank you.